Hi there, Ashley. Can you hear me okay? Excellent. Okay.
Hello, everyone, and welcome to this week's edition of Ask the Experts. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization headquarters here in DC. And this week, which is World Suicide Prevention Day today, we're going to be talking about suicide prevention during the COVID-19 pandemic. I'm joined here today by three special guests that I'm going to introduce. Firstly, we have Dr. Claudina Cayetano, who is the mental health advisor at the Pan American Health Organization. Claudina is a psychiatrist and public health practitioner with 25 years of experience in mental health service delivery. Hi, Claudina, how are you?
Good morning. Thank you, Ashley. Happy to be here with you.
And I am also joined by Dr. Eduardo Vega, who is CEO of Humanovations, a social impact consulting, training, and technical assistance firm focused on innovative solutions to the world's most challenging problems. A former Fulbright specialist and California State Commissioner for Mental Health Services Oversight and Accountability, Dr. Vega has led and served on health policy bodies, including as an invited expert to the office of the White House of President Obama. Good morning, Eduardo. How are you?
Great to be here. Thank you, Ashley, and everybody, Dr. Cayetano.
And last but not least, we're also joined by Dr. Raquel Thomas Caesar, who has over 25 years of management and research experience in natural resource management, as well as strong experience in proposal formulation, public relations, and issues related to corporate social responsibility. Dr. Thomas Caesar is co-founder of Guyana Citizens Initiative and Citizens Against Rape. She is a strong mental health advocate who is committed to ending stigma and discrimination as it relates to mental health and in particular depression. Good morning, Raquel. How are you?
Thank you for having me. Hello, everybody.
Thank you for joining us. So as I mentioned, every September 10th, it is World Suicide Prevention Day, and this has been going on since 2003. It's a day from the International Association for Suicide Prevention in collaboration with the World Health Organization. And the aim of the day is to promote world suicide prevention and provide an opportunity for people across the globe to raise awareness of suicide and suicide prevention. So the theme of the day this year is working together to prevent suicide. And of course, we find ourselves also in the middle of, the very unexpected and challenging circumstances as we cope with the global COVID-19 pandemic, which of course has likely had an impact on the mental well-being of most, if not all of us. So really this year, more than any other year, it's crucial that we work together to prevent suicide and to address these mental health issues during COVID-19. So as per usual, we're here to answer your questions. If you have anything for our experts at all, please don't hesitate to put it in the comments section at the bottom of the Ask the Expert Facebook Live, and we will ensure that we get to it during the next 40 minutes of this Facebook Live session. But in the meantime, I have a few questions of my own. So firstly, I wondered if you could talk to me a little bit about how the COVID-19 pandemic specifically has impacted people's mental health in the region of the Americas. I don't know if you want to get started, Claudina.
Thank you very much, Ashley. And this is definitely a very important topic, and I'm glad that I know we are focusing today's World Suicide Prevention Day. And this is a topic that sometimes people don't really want to be talking about. So I'm glad that we dedicate this day to do that, particularly when it comes to COVID and the implications of COVID on people's mental health, on people's psychological well-being. So there have been a couple of research, a couple of studies that have been done. You know, we started this pandemic from March. So, now April, May, so over the months, there have been some research to show that 50% in some findings, people are experiencing psychological distress. People are having, more depression, more anxiety. People are experiencing, more like insomnia, compassionate fatigue, and all these symptoms. So you find it's not just among the general population, but we also have healthcare providers who have also experienced a lot more distress because of the work that they're doing. Additionally, we also have done some research, and yesterday we had a webinar from our expert in advisor in alcohol to reveal a finding of how the increase of alcohol consumption among the population, and the consequences that bring. So definitely some studies from Brazil, from the US, from Canada, from Mexico, and then studies not only about the general population, but even about, with adolescent, the youth that have also experienced some challenges with their education, with, employment. So this has been, no one is exempt. Definitely that has a lot of impact on people, and I think there's definitely the opportunity to talk about what it means in terms of being affected when your mental health is being affected, because clearly affects your performance, your concentration, and it impacts your ability to be able to care for yourself and for your family.
Right. We're already getting a lot of comments, not questions so far, from our audience. So Adisu Teresi has said, this is a critical issue which needs attention, particularly for healthcare workers. We're also getting a few comments from our Spanish-speaking audience. Don't worry if there's no translation at the moment. My colleague Sebastián Oliel will be hosting a very similar Ask the Expert in Spanish at 2 p.m. Eastern Time today. So if you're a Spanish speaker and you would like to connect to that, then come back at 2 p.m. You mentioned, Claudina, that the pressures of living in a global pandemic, and at the moment in Latin America and the Caribbean, we are the epicenter of the COVID-19 pandemic. So we're feeling the brunt of it, probably more so than other regions in the world at the moment. Sorry, the Americas, not Latin America and the Caribbean. And of course, that's related to being worried about getting COVID-19. It's also related to some of the public health measures that have been implemented. Many of us were in very extended lockdowns for a few months, including us here in Washington, D.C. We haven't seen each other for many months. Eduardo, I wondered if you could talk to us a little bit about your own lived experience with mental health issues and what really helped you the most during your recovery.
Um, yes, and I'd like to point out that so I've prepared some remarks, but I definitely want to, have us feel like we have some time to converse. However, I'd like to focus on a couple of issues specifically related to kind of connecting the dots between what we know and think about suicide prevention in the field of suicidology, as an example, and my own lived experience. And I think that that could be a little bit helpful. Does that make sense?
Of course, go for it.
All right, great. So it's very important to me to think that prevention of suicide, focus on this current moment and on psychological distress, and move away from discussions that are too much about interventions related to thoughts and feelings of seeking death. That's to say, we should change the conversation, I think, to really about how we help ourselves and other people stay alive when we are facing suicidal intensity. We want to move from a discussion of suicide risk factors to protective factors. And these are the natural factors that influence our communities that help people get through things. So rather than seeing suicidology or suicidality as an acute mental health condition requiring intervention, we should adopt a public health model of suicide prevention that focuses on helping people find meaning in their encounters with suicide, while averting, of course, potentially lethal behaviors. The big reason I would focus on this is that what traditionally has been the sort of center of suicidology is risk factor measurement. However, it's never been proven successful at predicting or reducing suicide deaths. And secondarily, the view that suicide is an acute expression of mental illness that should respond to psychiatric treatment is also limited. I guess what I'm trying to say is that, people around the world are facing struggles and intensity, and thoughts of deaths and thoughts of suicide are not necessarily abnormal. Although, of course, they're related to things like depression and anxiety and obviously distress of different sorts. Suicide shouldn't be thought of essentially as an expression of mental illness. We should be talking about it and helping people get through those tough times with a focus on resources and hope, etc. So most people who die as a result of suicide, in fact, don't actually connect with any mental health services at all. And this is true around the world. In some places it's a little higher than others, but in most places, people who die of suicide, less than 50% actually connect with mental health care in the way that we think about it. So what we need to do is think about like this as a social issue. And around the world, we recognize that difficult challenges, even crisis, are where people find new meaning to. So this is one of the ways that I'm hoping that we can talk about suicide and distress, because even when times are hard, we gain information about ourselves, people grow, these changes become sort of transformative and significant in their life. In my work with hundreds of people experiencing what we choose to call, what I call suicidal intensity, I've come to believe that thoughts, feelings, and behaviors related to suicide are nearly always a way of seeking relief from our overwhelming inner pain, as opposed to a desire just to die. So if we can move away from thinking about those as inherently negative experiences and view encounters with suicide as a piece of personal growth, we have a different way of having a meaningful, humanizing conversation about what people are struggling with. And so my personal story, I survived 2 suicide attempts at the ages of 19 and 23. And in the wake of both of these, I learned important things that helped me guide my way through towards a happier, healthier life. I also faced a lot of despair and feelings of isolation at the time. I want to kind of connect this to the idea of risk factors and protective factors. So as a young person, I lived with a mental health condition, and I was undergoing a lot of stress. I the first thing that happened that made a difference was that I got a job assisting disabled people. This was sort of after my second suicide attempt, but I was still thinking about suicide quite a lot and kind of determined to kill myself. And I got this job sort of accidentally, but through it, I learned that I could help others who were less fortunate than me. This relates to what we call the protective factor of meaningful roles. So from feeling kind of isolated and helpless as a student to having a role that seemed meaningful was a kind of a big jump. The second big thing that happened was that I met somebody else, including another young man who had just survived an attempt, and identified this first because he had fresh scars on his wrists, and we became good friends. To be honest, we didn't really talk about issues related to suicide too much, a little bit, but the fact was that there was somebody that I saw who had been there, who looked like me, somebody I could relate to and that liked. And so that element of recovery was really significant. And, you know, in a certain sense, this relates also to when we talk about peer support and other things, which I know we'll come back to later, the protective factor of connectedness. So connectedness being the protective factor, isolation being the risk factor, so to speak. You know, over years, I still had times of suicidal thoughts and feelings. It was not uncommon for me for several years. But these aspects really make a difference. And as we move forward, talking about and kind of recognizing that, you know, so many people, as you pointed out, in our hemisphere and also in the world, are going through these really intense life struggles now, social struggles that are impacting everybody's mental health. And in that, and particularly when you're talking about things that are, you know, not necessarily just about emotional health, but also real factors related to employment, related to being able to provide your family, see your family. I know in previous conversations with folks in South America that there was a lot of concern because people were unable to even be at funerals and have, you know, proper sort of support for grieving family members who had died, et cetera. So in all of this stress, and as discomfort and emotions come up and kind of turn into distress and sometimes despair, thoughts of death are not that unusual. They're not unusual. They're not, I would suggest, a symptom of psychopathology. They're a way that people are thinking about processing, trying to like manage overwhelming feelings. So seeking relief by thinking about, and then ultimately in less chances, but sometimes attempting to kill yourself is not to be stigmatized. It's not to be criminalized. Wow. It's something that we can approach with humanity, bring ourselves an understanding and compassion to, in the recognition that as other people are suffering and struggling, we have also a great resource of compassion and connectedness to bring to that conversation.
Brilliant. Thank you so much, Eduardo. You definitely mentioned a couple of points that I think were particularly interesting, you know, especially when you discussed language, which I'm going to talk to Claudina about in a minute, around suicide, but also when it comes to recovery. And you mentioned, you know, finding the role, working with people with disabilities, finding a peer with whom, you know, someone who could relate to that particular situation. And I wondered, for Raquel, you know, was it similar? You know, we know that you've had your own lived experience with mental health issues, and I'd like to find out a little bit about your recovery and whether, you know, some of those coping strategies that Eduardo mentioned were also, you know, you also found solace in, I guess.
Yes, thank you. Can you hear me?
Yes.
Yeah, good. Yes, I connected a lot to what Eduardo was saying, and I really thank him for sharing his experience. In my case, what happened is that I decided I went to the UK to study, and And what happened is there between, you know, some personal issues I was going through. Also the weather, it was dark. I did not realize then. I didn't know what depression was, right? I didn't
18
have
years of it.
consciousness
Raquel,
of
18
it.
years of it.
Yeah. So, and then the PhD was started challenging me. And for somebody who comes from the Caribbean where failure is not accepted, you know, and you think you're failing, it really got to me. And I started getting these overwhelming feelings. At one point, I actually thought, oh my gosh, I'm going mad. I'm going crazy. This is what it feels like to actually have a nervous breakdown. And it's at that point, I felt that I didn't want to live anymore. And I was ashamed to talk to anybody about it because, you know, I'm supposed to have it all together, right? And at that point, I did take some pills. And the message I want to get though is that to get over is that we need to seek help when we're having these feelings. I didn't know what the feelings were, but people are talking about it now. In 25 years ago, they were not, right? People are really talking about it now. And in my experience is that when I took the pills, I reached a point that it's like, oh my God, I don't want to die. What if I chose a method that, you know, other people have chosen? And 2014 or 2015, one of our staff drank poison at our office. And the thing about that really hurt us and hurt me is that as somebody who has had depression, I didn't see the signs. And we have to realize that people, when you're in certain spaces, you hide it. When I've gone through depressive episodes, people don't know because I'm highly functional. I can make speeches, I'm highly functional. And I've learned to cope. And my coping mechanism is actually going to groups of friends and talking and so on. I did go to a doctor once. He gave me Prozac. But I looked at the pills and I figured I knew I had to get out of this. And what happened is that I came back home to continue my PhD and I started working in the forest.
Right.
And I can tell you something, nature is a healer. Within a month of heavy lifting, exercise as well, I had to do a lot of exercise. Well, I have lifting, setting up my experiment and so on. And in a month, I was fine. And just being surrounded by that energy of the forest, the rainforest, it was a connection for me. And I always say the forest is my medicine.
Right.
And I think for people who are looking for coping strategies, I do think nature is one. Now, there's the stigma. It took me 17 years to talk about it. Only my parents knew. My siblings didn't know. I couldn't even talk to my siblings. Only my parents and a couple of friends that were in the UK. Even my supervisors didn't really understand that I tried to take my life. I was so ashamed. And in the depression too, I started eating a lot. So I put on weight. So that added a lot of depression to me because I was like suddenly coming back home because all my research was in Guyana in the forest. I came back home plump, which didn't help. So, you know, there's many things, but the stigma, but the good thing now is that people are talking about it. Right. And what we have to understand is what's common. 1 in 4 people in their lifetime will suffer from anxiety, depression, some form of mental health. And we just got to get it in the open. And I tell people, look, this thing, just like how we can talk about cancer, this is a physical illness for me because what I learned in a workshop once, it's the illness of the brain. The brain is a physical organ. And what is going on in the brain is that it's chemicals. I'm not a medical doctor. I have a PhD in ecology, forest ecology, but I know there's something going on. The brain is not well and you are not rational. The moment you make that decision to commit suicide, it's a lot of pain, but it's when you're well, you know that it's irrational. Mm-hmm. What you're thinking. Interesting. And then suddenly when you're well.
It's interesting what you say, Raquel.
Yes, go ahead.
You know, of course, there's historically been a tremendous stigma around mental illness. But I think one of the points also that Eduardo raised that it's important to keep in mind is that, of course, and I don't know if I'm using the right terminology here, so Claudina,
Yes.
you just have you know,
Yeah.
what I would call maybe erroneously suicidal ideation isn't just a result of mental illness. And one of the coping strategies that you've both mentioned, which is, you know, throwing yourselves into various other activities. Raquel, you mentioned exercise, work, and mostly talking to people, is a resource that even in the context of the COVID-19 pandemic, you know, we do have access to, or need to ensure that people that maybe don't have access to it, that are living a bit more in more situations of isolation, can obtain access to. But just going back to the language issue, and without wanting to spend the rest of this, you know, half an hour stumbling over my words, Claudina, can you tell me a little bit about the language surrounding suicide and why it's so important that we get things right, you know, particularly from a communications journalistic perspective as well?
Thank you, Ashley. And you know, this is so important because with Eduardo, with Raquel, and with you talking about this topic. So I like the idea that, you know, the theme this year is working together. And when we say working together, I'm the only, you know, like we have PhDs, we have people with different experiences, but it's us together that will make a difference in talking about suicide. So it's not that you have this webinar where you only have professionals, mental health, like only psychiatrists, only psychologists. No, it's about all of us because it affects all of us.
All of us.
And I like what has been said in terms of we focus on prevention. That's the word, World Suicide Prevention Day. It's about prevention. It's about strengthening the protective factors. It's about understanding how do we decrease the rate, because it is high. And in spite of knowing so many things, it continues to increase. So when it comes to language, when we talk about suicide, language matters. So, you know, when you say the word committed, what do you think of? You think of something criminal, right? And so even that, we want to be able to approach it differently, because you don't say that someone committed, I always say about committed heart attack, you know, people die by a heart attack. So when you talk about suicide, we talk about death by suicide, died by suicide. And I think, you know, Eduardo and as the same Raquel has brought the point of this is not necessarily, we're not talking about a mental illness here, we're talking about a situation where a person becomes hopeless or helpless. So when you say suicide, so people will say, oh, she failed, she attempted, or she was unsuccessful attempt. This is not about, you know, success, or it's about, it's an attempted suicide. And then people do have ideation, so the thoughts. So thanks for asking the question, Ashley, because we want to be able to focus on, you know, on having the appropriate language. It helps to decrease the stigma. Hopefully it helps to have people want to seek help and look for help, and not to feel ashamed if they are experiencing these thoughts, if they have, you know, feeling hopeless or helpless or have suicidal ideation, and they are not going to be blamed because of that. They're not going to be judged because of that, that it's okay to seek help. And that's what we want to focus on, how to support people to be able to find answers to their situations. So this is, so the language definitely important. We don't want to be talking about committing. Committed is a criminal offense, and it's a death by suicide. It's a suicidal ideation or suicide attempt. I think those are the things that we want to be focusing on. Thank you.
Thank you. So, oh, Eduardo's popped back. I thought we'd lost him for a little bit there. I'd like to go back and talk to, you know, maybe Raquel a little bit more about the stigma aspect, because I think that it's really important. But before I do that, I wondered if, Eduardo, you could talk to us a little bit more about the role of peer support and why that's so important in larger suicide prevention efforts. Because I think that that's something, you know, that's a resource which is maybe more easy to obtain at the moment during the public health measures that many current countries are experiencing in the COVID-19 pandemic.
Yes. So I think and my company, Humanovations, it's a lot of what we're doing is helping communities build resources and giving people skills and understanding to like practice peer support in a way that's distinctly helpful, and including in areas related to crisis and suicide, because that's an area where it hasn't really existed so much before. But those of us who have been there, and many people around the world who've encountered, suicidal intensity. And again, we can talk more about the language issue. I have been working on a lot of that, kind of moving away from clinical language and definitely moving away from criminalizing language, as Dr. Cayetano suggested. Very, very important that we be able to have human and supportive languages, because people feel so isolated often when you're in this really intense state and you're experiencing a lot of despair, and maybe you're having thoughts of death. That's already very isolating. And if you feel like you can't talk with anybody about it, or you feel like nobody can relate to that, or nobody's willing to, then you're going to be more isolated, right? So that's why into that, peer support can play a really distinctive role and can be very helpful, because you can connect with somebody else who's been there, and makes you, and that automatically lowers your stress, your sense of isolation. Now,
would you have any recommendations for, if I knew someone who I felt was experiencing those thoughts, what I could do as a peer to be there for someone else?
Well, definitely. And I would also just kind of point out that I do talks and training specifically on this. So glad to follow up and provide some suggestions in collaboration with Paco. But I mean, the most important thing is to feel like you can engage a conversation, and then you can connect on a sense of compassion. And as a peer, I think the other thing that's very powerful, as opposed to maybe being a provider or being in a traditional provider role, is that it's fine for you. I think it's really valuable to be able to express your own, feelings and your own truth about it. So if you're telling me something, Ashley, and I felt like, I could say, wow, you're talking about, having thoughts of suicide. That kind of scares me, but, how can I help? And really the most important thing that anybody can do, really, but on the level of kind of peer support as opposed to sort of services, is to be able to be there to make sure that somebody feels listened to. Mm-hmm. When people feel heard, they feel cared for, and they feel less alone. Even if you can't relate to exactly what they're going through, if you can express, compassion, and then from my point of view, also really interest, like we have a focus in our programs on what we call compassionate curiosity. And that's about exploring, like wanting to be able to be closer to what you're going through, even if it's hard, and have a really human conversation about it, that makes you know that you're not alone, you're not very strange for having this, and there's not something wrong with you because you're having these thoughts and these feelings.
Right. I wondered, oh, sorry to interrupt you, Claudina.
No, I just thank you, no problem. Sorry to interrupt you, but I kind of I know we're going to be, asking about another role, like, when you would ask, I guess, Raquel about her experience and the family role. But I just wanted to emphasize what Eduardo was saying, because I really like the concept of the peer support, just because it gives the opportunity of having that emotional connection and having someone who has walked the walk, who is not just talking the talk, it's just someone that you can connect with because of their previous experience. So it makes the emotional connection, I think, really more at a personal level rather than at a medical level. So I like that you had asked Ashley about what does it mean, because I think it's important that we foster that. We foster the importance of peer support. So just to add to the importance of of that concept.
Yeah.
That is not that immediately sending someone to, okay, you have to go see the doctor, see the psychologist. No, maybe you as a friend, as a colleague, if you have that, you know, if you know what it is, that you can start by doing that. So I thought it was an important concept that we want to foster. Back to you, Ashley, sorry.
Yeah, I mean, just following up from that slightly, Claudina, you know, I think it's one thing to have peer support, you know, someone who's maybe experienced the same situations and can understand, you know, how a person might be feeling if they're thinking about suicide or they're having suicidal thoughts. But when we look at friends and family and listen, of course, that, you know, what Eduardo was saying about genuinely listening to someone and, you know, rather than just kind of, and I think we do that in lots of contexts, not just in mental health, we kind of, you know, impose our views a little bit on someone's life situation and don't really genuinely listen to what they're saying. But when it comes to suicide and when it comes to family and friends specifically, I know, for example, that if one of my family members or one of my friends were to approach me with, you know, this is what I've been thinking about, this is how I'm feeling, I would be genuinely terrified. So, you know, I don't know, Raquel, if you can talk a little bit about the role that, you know, taking that on board, it's certainly not an easy role to have, I don't think, for a family member or a friend or someone who's really emotionally invested in someone else being okay and being alive. You know, what recommendations we can have for family and friends?
Yeah, I think it is a very difficult situation. I think for people who haven't, if you're not a healthcare provider, but for people also who've never experienced it, is very difficult, because quite often part of the stigma is like, oh, but you're okay, you look fine. What's your problem? Just snap out of it. One of the things people think is just something that you can quickly get over. And that is not true. Sometimes it takes months, weeks, months, if somebody has an accident, and sometimes years, if somebody has an episode. But for me, I had a few people that I could have spoken to, but they weren't my family. It was only until I spoke out about it. My sister was in health. She is in health services in terms of pharmaceutical care. She started talking to me. She said, but Raquel, you never told me about this and so on. And she, you know, and what I learned too, and some people may not be aware, I learned from a psychiatrist that in some families you might have a predisposition to mental health issues. And I think many people are unaware of that as well. But the stigma, the part of the stigma is, especially if you are in a position, then for me, in a career, people see me, people have, when I started speaking about it 17 years after the fact it happened, I had people call me, people whose somebody's daughter had committed suicide. I've had them talk to me, and thankfully I've been able to help. I've had friends who I thought were all together as well that have thought of doing it. One even was a medical doctor who deals with patients with these issues and so on. So I think we have to be more open about it and understanding it can affect anyone. And right now with COVID, many people are stressed. Many people have lost jobs. The financial issues cause a lot of stress on people and cause a lot of people to go into this feeling that they can't really support their family, they can't support themselves, what to do, right? But another thing I want to talk about is investing in our youth. Our youth are also, I have a 13-year-old. She hasn't been out to school since March. She hasn't seen her crowd of friends. I'm grateful for WhatsApp. I'm grateful for Zoom and so on, because outside of those, she would not have had a connection with them. And for her friends are very important. And what I signed her up in a course the other day, and I also took the course called Art of Living. And for her, it was for teens, learning about emotional intelligence, how you deal with your emotions, how you deal. So learning breathing techniques, learning meditation. And I do think in schools, I think this can be a way of helping young people cope, so that you learn those coping methods early. I didn't have my situation until I was 25, because I never had anything. I was like happy-go-lucky, you know. So if I had known about it earlier, so we have to be honest with our kids too. We have to teach young people about these things, these issues. Anxiety. A lot of young people suffer from anxiety. So we have to teach them coping skills and coping methods. I really think the nature thing is for me, I recommend that person should have some connection with nature, even if it's just going in your yard and standing in the grass, connecting with the earth, the energy of the earth. If people are religious, prayer, right? Meditation, all these tools, exercise is important. And all these little tools that we can use. But peer, the thing for being a peer, you just have to have, you don't necessarily only have to have had an experience. You have to have a compassionate heart and an ear for listening. Because often people just want to talk. They don't want you to solve the problem. I don't expect anybody to solve my problem. Just having somebody who is there understanding that there's pain there, that you're going through this, but also to say, this too shall pass, because it passes. It really does pass. And I think if there's any message we need to get out there, is that message that you can battle it, you can beat it, and you need to talk to somebody, not get to the point where you want to take your life or attempt to take your life, because there is that point when you realize, I don't want to go anywhere, from my experience. I don't know if Eduardo had that experience, but he's still here.
We both are, thankfully.
Yes.
I think, you know, both you and Eduardo have given us a lot of insight into, you know, what individuals can do. You know, you've spoken a lot, Raquel, about you know, what people can do for themselves. And I think a lot of those recommendations, you know, they aren't just applicable for people who are thinking about suicide, but they're also applicable, you know, and of course the focus of today is on prevention.
Yes.
They're applicable to people, to everyone, I think, living, you know, under these public health measures, and maybe should be implementing a lot of these strategies. You mentioned nature, exercise, talking to people. Eduardo mentioned work, etc., etc. I wondered, you know, when it comes to governments now, you know, let's move from sort of the individual responsibility onto policy. You know, at a country level, Claudina, what can governments do to prevent suicide in their populations? What should we be asking for on a sort of bigger national scale?
Thank you, Ashley. So this is so relevant that you're asking this question, because, you know, one of the things, as you know, PAHO, as a health UN organization working in health, we support our member states, we support countries. And one of the things is to have a map, to have a strategy, to be able to you know, have suicide prevention strategies. And these strategies are not to be dominated only by Ministry of Health, for example, because as we've been saying, it has to be bringing all sectors together. It's multi-sectoral. So the first thing is that for the government to be able to, you know, place high on the agenda the issue of suicide prevention, having that political commitment in terms of having suicide prevention plans, investing in suicide prevention strategies. We have so many there is things important, what guides and interventions and strategies that are evidence-based. So we want to be able to support, we want the government to support that. So as you perhaps, we support countries in developing this plan, one of our targets was to have at least 30 countries by this year, 2020, and we have almost over 20 countries that have suicide prevention plans. Another thing that countries are doing, which is fabulous to see, for example, when Raquel was talking about, learning in school, what do we teachers who know about these things? So they are also implementing. We did that just recently with Jamaica, and we have done it in Belize, in Barbados, in the Bahamas. And we invited other countries to come to our training on a school mental health literacy, which is for teachers to learn about, mental health. And that's also government, we see them implementing that. Another thing that is relevant, as a journalist yourself, probably be able to appreciate the fact that we also encourage government to be vigilant in terms of how it is the suicide reporting is being done. So a few years ago, we did a training in Trinidad on responsible reporting on suicide.
We did one the other week as well, Claudina, that people will be able to access. So,
Sorry?
I said we also did one the other week in the Caribbean.
Yes, we did another one the other week for reporting on suicide and during the pandemic. Yeah, of course. So you see, it's so relevant how it is reporting being done. And so we encourage government to institute this kind of things, because it's the only way that they can guarantee that, well, not guarantee, we can't have a guarantee, but at least our aim is to reduce the rate, or the suicide rate in the country. So our aim is to foster this prevention, to have people feel more connected. So if that is to happen, I think the government has a role to play in doing this kind of thing. And then have this support group and have sessions where it becomes open about talking about suicide. I wanted to, when Raquel was talking about the adolescent and the youth, maybe I'll do a little bit of press here, because with our adolescent health unit, our advisor, Sonja Coffey, we've been working with PAHO, and we have a Hangouts for adolescents. So I'll find a way to put the link there so that
Sonia is connected. I've seen her in the comments section. So
okay, fabulous. So Sonja, please put the link there, because yesterday we had a hangout with adolescents and the topic was suicide prevention. So that is also happening in terms of how we want to bring them on board. I think it's definitely very important, and it was impressive to what they decided to do. How they're into the Twitter and the Instagram, and using the hands to connect and promoting safe conversation on suicide. So I just wanted to mention that, but I think definitely our work with the government is to provide that technical guidance in terms of how to strengthen the services and the discussions, and what are these interventions that we know can help to support people as especially when they're going through suicidal issues. Yeah, thank you.
Brilliant. So I just have, I'm aware that we're running out of time, so I'm going to ask our panelists to be succinct for the next couple of questions. I just have two more, and excuse the sound of rain that's beating on my roof. I've brought the British weather with me, Raquel. We've spoken about individuals, and we've spoken about government and policy level interventions that really need to be put in place. But in the context of COVID-19, Eduardo, what can communities do, and how can we empower communities to prevent suicide?
Well, I think that, having the discussion and opening up the discussion is really the key. And I wanted to circle back to kind of the question you asked, point you made before about people being afraid of the subject, because it is a hard subject for people, particularly if you haven't been there. And acknowledging that is okay. I think it's important, actually. Because it doesn't mean that we want to take focus away from ourselves if we're talking to somebody else who's experiencing a lot of distress, but recognizing that and being honest about that, I think, is really valuable. So reflecting that, having conversations that support a person's experience, reflecting that, we don't want to see anybody die as a result of this, but also it's not abnormal. It doesn't make you bad or sick to have these thoughts. And then working to create conversations that are about collaborating. How can we collaborate, to help you get through this, learn from it, grow through it without taking lethal actions. And then what do our communities need to do to have conversations about how to manage distress, and also kind of connect, I would say, to what Dr. Cayetano was saying, that we need to also make sure that governments, both local and national, are fostering a positive conversation. I wanted to ask her, and maybe that's for another time, but about how many countries within the hemisphere still have criminal statutes related to suicide. Obviously, this is one of the things that people on the other side really experience and fear, is that not only our family members and others might have a very fearful reaction, but that there might be coercion or a sense of taking away people's rights or responsibilities, even criminal prosecution in some cases, in some parts of the world. I mean, it's not just illegal, it's very harshly punished. So we need to make sure that communities are together and having meaningful conversations and opening the door. And even if that means, ideally what we really need, I would suggest, is good training, good communication strategies, about sort of what constitutes safe messaging, but what also is really important for people to hear when they're going through these hard times.
Right, thank you. And I wondered, Raquel, if you had anything to add to that, specifically relating to, reducing the stigma and communities' role in ensuring that.
Yes. One of the things that we noticed during COVID, and in some communities, at least I experienced it with some Indigenous communities, is they were told that alcohol helps to prevent COVID. So you can understand the problem that's causing. So people are drinking, some people are drinking these high level, this alcohol that are not good for drinking, because they think, and I really think we need to get some messaging within all communities, in I don't think it's only a Guyana problem, that, those alcohol with 70%, so, it's really not for drinking and it's not safe. So how can we get messaging in communities? One great thing that Guyana has done, remember our communities speak, we have 9 Indigenous languages. And so they have provided general information on sanitation, how you wash your hands and so on, in all the languages, including Guyanese Creole. So we're saying 10 languages plus English. So I think that is one way, because remember, elders in some of these Indigenous communities, they speak their original languages. They don't speak much English. So I think how we communicate in communities, not just sending in brochures and so on, but getting on the radio stations. There are community radio stations here now. So getting those messages and getting them in the languages that is most suited, I think is a good way. Also, I want another partner, including, I think we all have to have the will. We're in this together. It's not just about government. We have to help the government. NGOs have to work. We have to have the religious organizations, but universities have a key role to play in research. We sometimes make pronouncements without research-based data. And we need to have those data before we can jump to conclusions about suicide or suicide awareness and so on. In Guyana, we have one situation where there's easy access to pesticides and we have a huge suicide rate. Kids, from what I understand, even teenagers can go and buy pesticides, and that is a problem. And there's also some music and some movies that promote suicide as well. And we have to really pay attention to those as well. Workplace awareness. We may not think it's important, but I realized how important that was when our colleague committed suicide. We had to have somebody come in and also counsel us, because we were traumatized. We really were, because we didn't see it coming. And I just want to implore the public just approach people with kindness. We just don't know. It can, just a little bit of kindness can go a long way. We just don't know, just a smile and just saying something good to somebody can prevent them sometimes from making that step, right? So, and I would encourage everyone as well, whichever countries you're in, to put the suicide hotline numbers in your phone. Have it accessible so you're not, if somebody comes to you for help, you don't have to be running around looking for it. So just put it in your phone and you have those numbers there that they can go and seek professional help immediately.
Thank you so much, Raquel. And we'll put the numbers if we can, or we'll certainly put our...
I can put the Guyana numbers.
Brilliant, thank you. And then just finally, I wondered, Claudina, if you could just talk to us a little bit about what PAHO is doing to promote mental well-being and prevent suicide, and any resources that we have that people can access.
Thank you. And I wanted to mention, Raquel, as you know, our colleague in the PAHO office in Guyana, Mrs. Karen Roberts. So you know that Guyana has a radio program. It's okay not to be okay. It's a daily program in Guyana, and I was very pleased to hear that she had mentioned, they have a lot of people listening, and these are one of the things I will encourage to make sure is, and then they talk about issues such as mental health. I also like the point that you raised in terms of the alcohol. As I mentioned at the beginning, Ashley, that from our expert advisor from Maristela Montero, that alcohol, there is a research in terms of the impact, the increased consumption, and what does that mean? So she just presented the data yesterday. So the question is how PAHO is supporting countries. So we support countries by looking at what are these evidence-based strategies that we know work. So for example, policies to reduce harmful use of alcohol. We're supporting countries with that. We're supporting countries to develop their mental health plans, and that addresses programs for suicide prevention. We support countries in terms of raising awareness about suicide and substance use, mental health disorder. We have, for primary care providers, we have a tool called MHGAP, Mental Health Global Action Program. So through the MHGAP, we have training, and there's the training which is face-to-face and virtual. I put in the chat the online training that is virtual. It's self-paced. Anytime people can just, click to the PAHO has a lovely campus for virtual learning. So it's an opportunity to learn about suicide prevention. We also, it's important, I'm glad that it was mentioned about the work that we do with universities, with NGOs. One of our colleagues, Eduardo, has been working with Andrea Bruni, which is one of our colleagues from the South America, because I think it's important to bring everyone on board to do this kind of work. So we do the training that we did with the journalists, providing us, guidelines on safe reporting. And we know that the issue of access is to means is a huge issue in many countries. So we do work with countries in terms of that access, and then the issue of criminalization, it is true. We have data, we know how many countries in the region still consider suicide to be a criminal offense, and that doesn't help people to seek help. And the other thing is that sometimes when someone dies by suicide, they don't want to take them to church, and if they're religious, it affects them. So family hides about those things. So we work with them in terms of that. So the way how PAHO works, the way how the prevention for suicide is a universal, individual level, and and then we do at a community level and as a relationship level. So all these different public health way of working, we make sure that we're supporting countries in not only with the programs, not only with the policies, but actually, to be able to strengthen the support that they provide. So if from a healthcare healthcare level, different levels of care, first level, second level, and third level. So the other thing is very important is surveillance. So we also try to support countries in data collection, because sometimes that is another huge issue that is not being reported because of the stigma, because of the data collection. So we don't know the exact numbers. So those are the things we do. Time is on us, Ashley, so I want to stop here, but you probably can mention about our web page where there is a lot more information for people.
I think what we'll do, Claudina, because there is so much and we're coming to the end of it, is that we're going to post the webpage on suicide prevention at the bottom. And that will, of course, direct people to resources. And of course, I'll implore our other panelists, if they have any other valuable resources that aren't hosted on the PAHO webpage, will be posted to let us know, and we'll be posting those as well. I wanted to thank you all for joining today's live Ask the Experts session on suicide prevention during COVID-19. Gone very quickly. We could have easily continued speaking for another hour, but more information will be available on our webpage. And of course, if you or someone you know is struggling with suicidal thoughts, please know that you're not alone and help is available. Reach out to friends or family or your healthcare practitioner, or contact your local suicide hotline, and we'll be posting everything in the comments section. But thank you for joining us, and we will be back next week for another session of Ask the Experts on a different aspect of the COVID-19 pandemic. I want to thank Eduardo and Raquel, and of course Claudina, for joining us.
Thank you.
We're going to be hosting our Spanish language session at 2, so anyone from the Latin American region who would like to join that, I'm sure the conversation will be just as valuable. So please check back then. Thank you very much, everyone, and we'll be in touch soon. Bye-bye.
Thank you very much for having us. Bye-bye.
It's an honor to be here. Thank you.